So this is the fifth year that we've done the member health insurance plan study here at J.D. Power and Associates. It's the largest study that we do in the year, so we've been really excited to see how the results might turn out. It was just a year ago now that President Obama signed the Affordable Care Act, or ACA. And you know, there's been so much conversation and discussion and speculation about what the impact of that might be, that we were hoping that these results might enable us to understand a little bit about how members were viewing what was ahead for them. In a way, the results are a lot like last year. Satisfaction is down. It's gone from a score last year of 701 on our 1,000-point index scale to 696. And in fact, it's gone down every year we've done this study. So clearly this is a chronic problem for health plans to address with member satisfaction. Unlike other parts of the healthcare sector like doctors or hospitals or pharmacies or even pharmaceutical companies, health plans have a much lower public reputation. So that's why it's particularly important to understand ways that they can improve their member experience, and that's exactly what this study's for. There really isn't any other study that provides as much depth and guidance about what to do to improve member experience. And it's a large study. We interviewed 34,000 people for this study. And the way we look at it is that we interview people across 128 health plans across the nation. Those are distributed across 17 regions, and within each region we rank the performance and identify which plan is coming out best at member satisfaction. In addition to that, we provide competitive benchmarks so that it's possible to really see where some plans excel and others are not doing so well. This year we found that 57% of members told us that they'd had changes to their cost or coverage within the last year. And that's a lot of disruption and confusion that results from that. People feel powerless about what they can do to control the costs of their health care. And on top of that, the benefits that they have become increasingly complex. There are high deductibles or maybe different levels of coverage which are harder to understand, and you put together the combination of increasing costs and the complexity of the coverage, and it makes it a very difficult situation for health plans to satisfy their members. So we like to be able to look at these results and see if there's anything they tell us about what's coming down the tracks. And one of the topics that's been a very interesting one lately is integrated delivery systems. Part of this is because the Affordable Care Act is encouraging the creation of accountable care organizations which resemble these IDS models. In an IDS, the providers and the plan are part of the same organization, so they work more closely together in concert. And this results in more seamless communication to the members because they know the member not just as a member but also as a patient. And in addition to that, IDSs historically have had less complicated benefit structures. The coverage is easier for people to understand and therefore easier to communicate as well. And the results are very clear in our study because we see that IDSs have levels of satisfaction on average that are a full 50 points higher than health plans that are not IDS. Another topic we looked at is the individual market, and we think this may be the largest study that's been done recently on individual purchasers because we interviewed 3,000 people. And we asked them about the level of satisfaction that they had compared to individuals that receive their insurance on the group market or employer-sponsored coverage. And there are more and more of them as small businesses increasingly drop their health insurance coverage. Less than half of people in the United States now are getting their health insurance through their employer. In addition, with the advent of exchange-based purchasing, there are going to be more and more people buying insurance on the individual market. Their level of satisfaction is much lower than people with employer-sponsored or group coverage. In fact, it's 641 on our index scale compared to 706 for the wider group of people with employer-sponsored coverage. So when it comes to almost any kind of administrative transaction, they're reporting a lower level of satisfaction. There are going to be some vast opportunities for health plans to improve the experience of people who have this individual coverage.